News at 11.
A breast implant nightmare has a Hollywood actress recovering from hours of surgery tonight. Sally Kirkland has a warning for all women. Her doctor is speaking out only on ABC 7. Eyewitness News reporter Miriam Hernandez joins us live from the hospital with the story tonight. Miriam?
Harold, this was a very difficult operation. The doctor tells us tonight it took 5 hours to remove the implant and all the scar tissue surrounding it. Truly a medical horror story that has implications for women and men also. She is an Oscar-nominated actress who went the limit to make Hollywood take notice. Here's Sally Kirkland in 1986, at age 42, showing off the silicone breast implants that replaced smaller ones she had before. There would be yet another operation in 1995 to replace the silicone with saline implants. Each time, her body reacted. The latest and most serious outcome is described by her surgeon.
What happens is that the breast implant itself gets surrounded by scar tissue. And if that scar tissue is nice and open, the breast implant floats around and feels very soft like a normal breast. However, if that implant if the scar tissue starts to shrink, there's no place else for the implant to do, but just like I'm squeezing against my finger, it gets distorted. And the implant starts riding up, the breast subsequently gets tremendously distorted, and in her case, with the grade 4, it's associated with a tremendous degree of intractable pain.
Haworth says encapsulation happens to a degree on all patients, whether the foreign object placed inside the body is a pin, a pacemaker, or a plastic sac. Kirkland, who was nominated in 1987 for her role in Anna, is an extreme case. Like talk show host Jenny Jones, she concluded that the implants had to go when the pain was too much for her to bear. Releasing this statement from the hospital, Kirkland says, "Many women look to celebrities as role models for their appearance. I don't want to feel responsible in any way that I might be the cause of another woman getting implants and having to suffer the way I have for 10 years. Haworth says that this condition develops in 5% of all patients, but in 1% of the cases, the pain and the scarring only gets worse. Such is the case with Sally Kirkland. She's going to be okay, but she'll be here for the next few days. Reporting live from Century City, I'm Miriam Hernandez, ABC 7 Eyewitness News. Now back to you, Laura.
Thank you very much, Miriam.